Hi, my name is Jamar Hawk, and this is my video blog 6. Today we're going to discuss the number of risks electronic health records create in the healthcare organizations. We're going to list them with examples and justify how these issues can be resolved. Also, I'm going to discuss very briefly how EHR works with the risk information system. So, while the adoption of electronic health records systems promises a number of substantial benefits, including better care and decreased healthcare costs, serious unintended consequences from the implementation of these systems have constantly emerged. Poor EHR system designs and improper use can cause EHR-related errors that justify the integrity of the information in the EHR, leading to errors that endanger the patient's safety or decrease the quality of care for that patient. These unintended consequences also may increase fraud and abuse and can have serious legal implications when dealing with that. There are a lot of types of EHR risks within a healthcare organization. I'm just going to name a few of them. One would be the EHR system design flaw. The expanding capabilities of EHR system require increasingly complex software, which heightens the likelihood of software failures that may harm patients. A software flaw in the EHR system containing hundreds of thousands of medical records, such as a glitch that causes an inaccurate recording of the patient's like allergies or the medication that they've been taking, or even the time that they're supposed to be doing certain things, can adversely affect a large numbers of patients as a whole. To reduce this error, as far as the EHR the system design flaw go, and other unintended consequences, like the EHR system, it should not be like able to be marketed without being scrutinized or approved or subject to like ongoing oversight to assess the safety, the effectiveness, and the accuracy of the system. Industry standards should be established for the quality and principles and process for the design, and also the EHR system developers should like require to adopt these principles and policies within the whole healthcare organization. Some of the standards need to ensure the comprehensive quality, like management principles and process that are adopted throughout the EHR industry to provide assurance that the EHR will protect and meet the minimum level of safety and reliability and usability when it comes to the patients. Another risk when dealing with the EHR would be like you can have a poor system usability or improper system use, in addition to like the EHR design features and functions that can potentially contribute to like crazy healthcare qualities and errors that can result in improper system use. Like user errors occurs as a result of like the system being too complex to use, lack of user-friendly functionality, like the interfaces can be confusing, like the workflow incompatibility, or even just the limitations of the user themselves who actually try to use it. And to improve this, the EHR usability should be included in any EHR certification process. Also, the EHR certification requirement should define what a vendor product is not allowed to do in addition to what it must do. You got healthcare organizations and other providers should also like develop and implement policies and procedures pertaining to the appropriate use of an EHR system. And also, I personally think that all the users should like receive thorough training on the system and like an internal reporting system to identify like problems using the EHR or EHR related errors, and any other EHR related issue should be established within that thing. So the second part was like I said, I was going to discuss briefly how EHR works with the risk information system. like the electronic health record or the EHR software, like pretty much it's a system that allows medical professionals to quickly input information like on a new patient, creating a digital record that they update with each and every new encounter. The records indicate details such as the family history, the reason why they're there, like diagnosis and treatment, the medication that they may be taking. Then you also got your lab like results and other like vital detail that is needed to provide assistance to like the staff, the medical staff. So you got doctor office that use them to control access to patients' data more securely. And not only that, you got medical organizations that like maintain confidential data on patients that are required to protect it with like vigorous measures, or they could run the risk of violating like any kind of HIPAA privacy or requirements. So the EHR software itself is protected with strong encryption, and the doctors, the physicians, and the nurses, they can access this patient data on secure devices such as their smartphone, tablets, or laptops. And not only that, the EHRs can reduce errors. They can improve patient safety and support better patient outcomes. So it's like the EHR, they don't just contain and transmit the information, they actually commute it, means that they actually manipulate the information in ways to make a difference for the patients as a whole.